Thank you for joining today. I trust that all of you are doing well and your families are doing well during this pandemic. I want to get started by giving you a little bit of background about me and my expertise around this area. So currently I am the Executive Director of Clinical Research Finance at the University of Texas MD Anderson Cancer Center. I have over 15 years of experience in this clinical research finance arena and more than 25 years of experience in the financial and auditing arena. I am a certified public accountant and I hold a couple of certifications issued by HCCA. One of them is the healthcare research compliance and the other is the healthcare compliance. I have a full range of skill sets around clinical research billing, and I'm going to share some of that with you today. I'd like to make sure that I am really focusing on what you'd like to learn today. And so if there's any questions throughout the time frame, like Heidi said, put your little raised hand icon on, and then I will ensure that I address those questions. So let's start off by what we're going to learn today. Today we're going to really describe what is a Medicare coverage analysis. I'm going to go over the regulations around this particular document and why they exist, and then what Medicare's requirements are. And you'll hear me saying CMS very often. CMS stands for the Centers of Medicaid and Medicare Services, and we're going to talk about their coverage and why that's really important to get that coverage before you initiate the trial. Then the next thing we're going to cover is the purpose of developing it, truly understanding how we can use it for so many different aspects around this clinical research arena. And then the last step is the multi-use of that and how it impacts our revenue cycle. So let's start off with the purpose of the actual Medicare coverage analysis and what it is. So Medicare coverage analysis is actually just a detailed listing of all potential billable items and services as it relates to our patient care environment. And these are usually definitely listed in the study and must be listed in the study in order for them to be onto your Medicare coverage analysis. And this study is going to go through the IRB review and ensure that the IRB, from a human subjects protection standpoint, has actually approved that study before everything gets started. It also includes usually the billable items and service codes, so that way the billing office knows what to do with that actual charge when they see it. It includes technical and professional. Depending on your hospital setting or your setting that you're working in, it may only just be the hospital side, that technical side, or it may be your provider side, which is your professional billing. At our institution, we put both because our providers are employees of our institution. The other thing that it includes is the Medicare research modifiers that are required by Medicare, and those became effective in the year 2008, so those are required on the claim for Medicare services, and a lot of other insurance carriers like United and Humana are beginning to ask for those modifiers as well. The other thing it can include is any particular research discount rates. I know a lot of organizations will hear from a sponsor that your site is very expensive and that they will discount the charges down from their actual charge master rate. A lot of organizations will actually take their institutional charge master and create a research charge master, which is usually their institutional charge master just discounted down, applying a certain research discount rate that your institution will decide on an institution-by-institution basis. And then the last thing it should include is the funding source. Who is that sponsor of that particular study, and any other information that is pertinent for your organization. And the last thing that I wanted to mention is that the best practice for creating this in Medicare coverage analysis is that it's definitely required for all clinical trials, and that it should be done prior to the study activation. So this way, not only does clinical operations understand what needs to be done with the study and to care for those patients correctly, but also your billing office, when they receive claims associated with the study, they actually know how to process it accordingly. Here's an example of a Medicare coverage analysis. It's, as you can, and it's a little blurry, and so I actually have some handouts in the case studies that you have in your packet that we'll go over later today. But just kind of wanted to give you an overview of what one looks like. The study demographics are at the top the top part of your document here, and includes maybe your PI's name, the study name, maybe your IRB number that you've been issued by your particular site, and the date that this was created. And the reason why this date is important is because our regulations change, the coverage will change over time. So it's really important to understand when that was created, so that way when you're actually going back and doing a review or possibly undergoing an audit, that particular entity that's auditing you or looking at this coverage analysis knows that you created this particular document using the, in this case it says September 21st, 2018. You were using the local coverage determinations and the national coverage determinations that existed at the time. And we'll go through this in detail in the next couple of slides. But just kind of wanted to give you an overview of what this looks like, and you can see that there are actually the different types of categories, different types of tests that are here, the actual service codes, CPT codes are here, pricing, as well as the actual cycle and day information associated with the study.